29-year-old man presents to his provider complaining of not being able to get enough rest at night. He goes to bed early and has otherwise good sleep hygiene, but feels drained the next day. He's unable to perform optimally at work and has been avoiding social activities. He has eliminated coffee after 12 p.m. and has stopped drinking alcohol. He also exercises 3 days per week. About a month ago, his wife of 5 years asked for a divorce and quickly moved out. His blood pressure is 120/80, pulse is 95, respiratory rate is 25, temperature is 37. On physical examination, his heart has a regular rate and rhythm. Lungs are clear to auscultation bilaterally. A basic metabolic panel, CBC, and thyroid panel are negative. Which of the following statements best describes this patient's condition? So this is a man who has come saying that he can't get rest at night. He is following good sleep hygiene. He's trying to sleep, but still he feels fatigued the next day. He's able to perform at work, but not optimally, and he's been avoiding social activities. He has tried to improve his sleep by eliminating coffee, stop drinking alcohol. He's trying to exercise. Now they tell us that his wife has left him around 5 years, has left him around a month ago. She was his wife of 5 years. His vitals and everything is normal, okay? And all of his basic metabolic panel, CBC, etc. is normal. So most of you all have said that this developed within 3 months of stress. So you all were thinking that it is adjustment disorder. So adjustment disorder is kind of like a diagnosis of exclusion, okay? Usually it develops within 3 months of a stressor, lasts for less than 6 months, and does not really fulfill the criteria of any specific condition, and causes functional impairment, causes quite a lot of functional impairment. So yes, adjustment disorder could be a differential in this patient. But does he have that much functional impairment? Just try to look at him as a normal person, maybe a friend you have. He's sleeping, he's exercising, he's still going to work. He's just been avoiding social activities. He's sad that his wife left him. So he's just having some sleep problems. So basically, I wanted to think of something milder than adjustment disorder. Okay. So the correct answer here actually was option A. Symptoms will wax and wane, but may persist for 6 to 12. Okay, so this is a little vague. Let me tell you what they're getting at. Here, they're talking about normal grief that the person is going through. I'm going to give you all D here because it's a confusing question, and adjustment disorder is as good an answer as any. But here you have a more correct answer, which is normal grief. Because normal grief also causes some kind of functional impairment, but it's not as severe as an adjustment disorder. It's a very thin line. Like in adjustment disorder, the patient might not be going at work itself. Here he is going, and he still has the drive to do things. Like he's still exercising. He's tried to make his sleep better. He's better sleep hygiene. He's still going to work, but he's not performing optimally. Okay, if you have a breakup, or if your pet dies, there's going to be a few days that you might not be functioning optimally, right? That doesn't necessarily mean that you have adjustment disorder. Sometimes in psych questions, you have to sometimes let go of definition, and sometimes just have a look at it. Is this person just suffering from normal grief? And if he's suffering from normal grief, then well, DSM-5 doesn't explain normal grief very properly. So some things that you can remember about it, that it usually can last up to 1 year, and it will wax and wane. Like it will come in like waves and go. You can have some symptoms of depression, like 1 or 2 symptoms, like you could have fatigue or sleep problems or something like that. And usually the functional impairment is not as severe. And whatever sadness is there is kind of limited to the event for the person. Okay. And in contrast, adjustment disorder, which can be explained by D and C here, the symptoms develop within 3 months of the stressor and are persistent and must resolve within 6 months. Okay, this is the definition of adjustment disorder. So yes, this is a good differentiate, but this is like a thin difference between the two. That is, adjustment disorder it's going to be more pathological. There's going to be more impairment. This person is suffering from normal grief. Okay. Now option B is mild cognitive impairment can last up to 6 months. Well, they're talking about the cognitive impairment that this patient has in normal grief, that he's not able to perform optimally at work. And well, it can last as long as the grief is lasting, which usually lasts for 1 year. Okay. So yeah, so it's does not have to be up till 6 months. And option E here is symptoms are usually self-limited and may persist for 2 years. That's wrong, because symptoms are self-limited, may persist for 1 year. Okay, this is a difficult question. It has a little bit of confusing wording, but the good thing is maybe because of this question you'll remember that normal grief comes and goes, waxes and wanes, can have a little bit of functional limitation, and will usually last 1 year. Okay, so your main differentials here, if you see a patient like this, is going to be normal grief, which we saw, is going to happen after an event, wax and wane, last up to 1 year. It can be adjustment disorder, which we saw. Within 3 months of a stressor, lasts less than 6 months. Another thing that can happen is complicated grief, which will last longer, maybe than 1 year, and in which the patient is just not dealing with grief well. He has all of these maladaptive thoughts which are surrounding that grief. Okay, like if your pet dies and if you have this maladaptive thought that, maybe I definitely had something to do with the death of the pet, and you just can't get over it. You're just not able to move on with your life. Okay, so that is complicated grief. But the patient is not having a normal reaction to grief, not having a healthy reaction to grief. That is complicated grief. Okay, he's just going spiraling into self-guilt, loss of self-worth, and pity, and just not coming out of it. So that is complicated grief. And then you have major differential disorder, major depressive disorder, which is always a differential, with your SIG E caps more 5 of the 9 symptoms for more than 2 weeks.
Thanks for watching. Please give a thumbs up and subscribe for more.